Today we're going to talk about hormones, what they are. We're going to talk about specifically the female hormones and kind of how they regulate. And then I'm going to go and talk about treatment of the most common female disorders, okay? Menopause being one of them, more estrogen dominant type symptoms, okay? And we're going to go and talk about that. Okay, how indies are trained. Yeah, that's just in there for your information. And then also, if you want more information about naturopathic medicine, you're curious, ask me questions after or any other time. And these are great websites to go to get more information, okay? And the top one also has a list of all the licensed indies in the country. So if you have your mom in Vermont that wants to go see an indie, you can go in there and find one, okay? So that's helpful. All right. Understanding hormones. So I'm sure everyone in here at one point in time has said, I'm feeling hormonal. Who has ever said that? I'm just hormonal right now, right? We've all said that. What does that mean? Can anybody tell me what that means? Anybody wants to tell me? Come on. What?
Hormones are taking over your life.
So she said hormones are taking over your life. Okay. What else? What do you feel when you feel hormonal? Weepy?
No sleeping.
No sleeping? Anybody else? Come on, tell me how you feel. Cranky. Okay. So most of the time people just say, I feel like I just don't feel right. My body's not talking right. Something's wrong. Something's missing. And there's no formal diagnosis. It's just your body's not communicating right, your organ systems, right? Normally that's what people say. You just feel off, right? Am I right? Okay. So hormones are basically messengers within the body. It's kind of how your organ systems talk to each other in a way. To make a very complicated system non-complicated, in a nutshell, that's what it is. They go through the bloodstream and they talk to your body. It regulates your body, okay? The other word for hormone system is endocrine, if you've ever heard that term. That's why you go to an endocrinologist to get, that's the doctors that specialize in hormones, okay? So this is just a photo of your endocrine system, okay? These are basically all of the organs that secrete hormones, okay? You think hormones, you probably think of just estrogen, progesterone, but your thyroids are hormone, you have hormones from your adrenal gland, your kidneys secrete hormones, even your stomach secretes hormones. You probably didn't even know that. So, but the glands in the brain, the hypothalamus and the pituitary, are basically the ones at the top. They're considered your master glands, and they are the ones that talk to all your other glands, okay? So your glands talk to glands, okay? It's very complicated. You have your thyroid right at the base of right under your cartilage, at the base of your neck. Everyone's heard of the thyroid, I'm sure. And those secrete thyroid hormone that basically regulates your cellular metabolism, all right? And then you have your ovarian hormones that secrete your estrogen and progesterone. And that's what we're going to talk about a lot today with the female system, okay? You have adrenal glands. They secrete cortisol. Has everyone heard of cortisol? Stress, raising cortisol, belly fat, that kind of thing. They secrete cortisol. Your adrenal glands also secrete estrogen and progesterone and testosterone as well. And they're in charge of that production after menopause. So you'll probably hear me say a lot about the adrenal glands and looking at your adrenal glands when you're having female issues as well. So, all right. As we go along, if you have any questions, please raise your hand. I want you guys to ask questions. Don't not ask a question. Sometimes everyone learns more from questions than from me. Yes?
You're talking about estrogen and progesterone. Does testosterone play much of a part for women?
She asked, does testosterone play a part for women? Yes, it does. Sometimes estrogen can be converted to testosterone, high estrogen, and if you have a lot of testosterone, you can have problems too, particularly hair loss, acne, things like that. So yes, testosterone does play a part in female health as well. So knowing your testosterone level is good as well when looking at, female health. So that's a good question. So any questions along the way, please ask, okay? All right. I'm not going to fully explain this little graph, but I think it's good for women to know that your hormones do fluctuate throughout the month. I'm sure you're aware of that, and your hormones control your menstrual cycle. And this is kind of complicated, but I'm going to talk to you just about the top part here. And if you look at the bottom, that's a graph, the x-axis. X-axis is time, and that's a month, okay? So your cycle's a month on average, if you have regular cycles. And if you look at the top, estrogen and progesterone, you probably can't see this all that great, but it's very low at the beginning of the month, on day 1. That's when you start your menstrual cycle. Everything is very low. And then, so basically it's very low down here. And the top one is estrogen. You'll see this come up, and then you have this little spike in LH. This comes from the pituitary. I know I'm getting complicated here, but it comes from the pituitary gland, and that causes this rise in progesterone, okay? And this is how you want your hormones at the end of your cycle. And then at the end, you see how they both fall off? This drop is when you start having more PMS symptoms, right? Premenstrual syndrome, okay, cramping, all that fun stuff, irritability, don't talk to me kind of period. So basically, you see progesterone's higher than estrogen. A lot of problems with females that have a lot of heavy cramping, PMS, maybe endometriosis, fibroids, bad menopausal symptoms. A lot of times this estrogen is higher than the progesterone. Not necessarily high or abnormal, but it's higher. That's called estrogen dominance, okay? And I'm going to talk a lot about that. I did this talk at Green Acres not long ago, and someone raised their hand saying, well, I'm here to learn about menopause. That's estrogen deficiency and yada, yada. And I'm trying to make the point that a lot of women going through menopause is not estrogen deficiency, it's estrogen dominance, even though their estrogen is low. Okay, they're still dominant, cause a lot of symptoms and a lot of problems. Okay, so this is for menopause too, learning about all this. So, so in a nutshell, this is how your cycles are. If people have short cycles, it's because they're not having enough progesterone. Okay, so there's a lot of things you can learn about a woman just by knowing how her cycles are. Okay, hormonally. Okay, so that's sure. So a shortened cycle would probably, she asked what is considered a short cycle. The average cycle is usually 28 to 32, 33 days for a woman. So I'd say anything less than 26. 20. You'll have some women who have periods every 21 days. That's called a luteal phase defects, or most of the time it's their progesterone's not getting high enough. And a lot of times, women have problems conceiving, and so they'll give progesterone. If you've ever heard of a woman taking progesterone after, to get pregnant at the end, that's why, is to keep that progesterone high enough. Okay, yes?
What about long cycles? What would be the cause of that?
Long cycles, there could be a few causes. Estrogen dominance can cause that. Also, you might not be ovulating, and that cannot cause, there's a whole lot of, so you're going like 8 weeks without a period, things like that. That could also be not enough progesterone too. There's a few things that could cause that. And actually, people who never have cycles, amenorrhea, right? Women who either eating disorders or exercising a lot or other reasons, that you think their estrogen is low. They do have low estrogen, but they're still estrogen dominant. And something like amenorrhea, lack of menstrual cycle, can lead to problems with breast cancer and stuff in the future because they're still estrogen dominant. They're not even secreting any progesterone. Yes?
So if you've had a hysterectomy and your ovaries removed, then do you still have cycles like this?
And your ovaries are removed? No, you don't, because your hormones are not going to be cycling like this, but your adrenal glands have to take over estrogen and progesterone, because estrogen and progesterone is used throughout the whole body too, not just in your uterus to help your, and your ovaries to help with cycling. It's used for a lot of things, blood vessel health. So if your adrenal glands are not healthy, when you take your ovaries out or you go through menopause, meaning they can't secrete enough of those hormones, you'll have more symptoms, more hot flashes, night sweats. That's why, I like to, with the women going through menopause especially, look at their adrenal health at the same time. So you get an idea of what is happening with adrenals and female hormones and stuff like that.
It fluctuates though, probably.
Yes, it can. Mm-hmm. Do you have a question?
Yes. When women have shorter cycles, so you're saying
Right. That could be.
Are you going to go in later and talk about
Yeah, we can. Yeah, I'm gonna try. Yeah, I'll try to talk about. I could spend here all day talking about hormones and all that. But yeah, well, I'll talk about that in a little bit. Yes. Did anyone else have a question? No. Okay. All right. So, and I'll go ahead and tell you if you guys are interested. Sounds like this is kind of what's happening to the in your ovary during that time. So you'll see right when you ovulate, the egg comes out. Okay? And this is what's going on in your uterus. So you're shedding, and then all of a sudden, then throughout the month you're building up tissue, and that's to help with implantation if you were to get pregnant, right? And if you don't get pregnant, if you got pregnant, your progesterone would stay high, you see, because zygote, what's the term? The zygote that's implanted will secrete progesterone. But if you don't get pregnant, progesterone drops, and that's what causes progesterone and estrogen drop, and that's what causes a menstrual cycle. Fun stuff, huh? The body is actually very amazing how it does this. Okay. All right. So there's all different kinds of estrogens. I just want to make that point with this slide. Estrone, estradiol, estriol. Estradiol is the one secreted mostly during your menstrual years. Estriol is produced in the liver. It's a metabolic byproduct of estrogen. It's a weaker estrogen. Bioidentical hormones usually is a combination of estradiol and estriol. So I just want to make that point. That's what I just said. And estrogen, one of the biggest things for women who are having hormone problems is knowing what we call the good and the bad estrogens, because you can go into the doctor and get your estrogen measured. It looks fine. You have endometriosis, which is considered an estrogen dominant condition. And they're like, oh, your estrogen level's fine, no big deal. But sometimes your estrogen levels can be fine. It's the metabolites that are causing the issue. So you have good and bad, okay? They all play a purpose, but if you have too much of the C16, that can cause a lot more estrogen dominant symptoms, okay? More endometriosis. You're more at risk for breast cancer, fibroids, things like that. And I have more slides to go into more detail about that. But you can actually measure your metabolites, which is also a good thing when it comes to looking at women who are having hormone problems, whether it's, like I said, menopause, endometriosis. I say endometriosis, I see a lot of it. So I use that. Yes?
What is a metabolite? Is that like an enzyme?
Okay, metabolite. Good question. He asked what a metabolite is. So a metabolite is the byproduct of the hormone going through the liver, because hormones have to be detoxed in your liver, just like anything else. Okay, so the metabolite is what happens, and basically what happens in the liver after it goes through, and then it's excreted in the bowel usually. Okay, so if you're constipated, and you'll see that we'll talk about that. If you're constipated, you're going to have a lot of hormone problems, especially if you have a long history of constipation, which a lot of women do. So sometimes that is the cause of the hormone problem. Okay, yes?
So the liver can be so congested that it doesn't do its job.
Exactly. The liver can be so congested. And she said the liver can be so congested it can't do its job. And that is right. And we're going to talk about how the liver can get congested in just a little bit and why. Okay, why women are having these problems. That's what I'm going to talk about. Okay, but good comment. Yes. Okay. So the take home is that normal estrogen levels, like I just said, does not mean you're not at increased risk for estrogen dominant problems and risk of cancers in the future. Okay. All right, so this is just a little pretty slide here. And just showing the metabolites of estrogen, your 2 and your 16 over here, okay? And in a little bit, I'll talk about cruciferous vegetables, your broccoli, your cauliflower, Brussels sprouts, all the ones you love. They have something called DIM, indole 3-carbinol. It's actually a natural treatment I use pretty often to help. Basically what it does is it helps raise the good estrogens and drops the bad, and it works very effectively and can help with symptoms. So anyway, I'm kind of going all over the place here. I apologize if you're not following, so please ask questions. Okay. Okay, bottom line, you want more C2, less C16. Sometimes that alone helps with your I'm going to knock this out, hormone problems, okay? All right, so you keep hearing me talk about estrogen dominance, right? So let's go ahead and talk about that. Estrogen dominance is when basically you have too much estrogen compared to progesterone, okay? Okay, so, yeah, sure. No, ask questions.
So whether it's menopause, and in theory your estrogen is going down, it's still an estrogen
Dominant.
problem?
I'm going to show you, I'm sorry. Go, no, ask the question, I'm sorry.
Just, that was my question.
Because, let me show you a picture real quick. I'm going to jump to it since you asked that.
Well,
Right here. This is a little graph that you can see. This is menopause, this is age 25 through, so right here usually between 45 and 55 is what we call, where is it? Did I not put that slide in here? Oh gosh, okay. What we call the perimenopause time. Okay, perimenopause is when your cycles are kind of not regular anymore. They're kind of long, usually they're longer, shorter, they're kind of all over the place for a while. And basically what's happening is that your estrogen's dropping, right? So you are dropping estrogen levels, but your progesterone drops much more rapidly, okay? And especially with what you're going to learn about in a little bit, what we call xenoestrogens, which are environmental estrogens that are all over the place. This is usually way higher. And so when women go through menopause, their progesterone drops, they're very estrogen dominant. And that's when you're more at risk for breast cancer and things like that.
but then you also mentioned like endometriosis, which I assume that it's not just progesterone, it's more of an estrogen.
Right, more of an estrogen dominance usually, or a progesterone deficiency. So let me go back to, no, you're fine, that's great. So estrogen dominance is usually associated with these are some of the disorders. Breast cysts, uterine fibroids, endometriosis, PCOS, polycystic ovarian. That's also related to insulin resistance too, prediabetes, PMS. So especially a lot of cramping and a lot of people who have heavy, heavy bleeding, okay? Menstrual cramps and menopause, menopausal symptoms. Not all the time, but usually most of it's estrogen dominance, lack of progesterone, okay? Okay, so two scenarios. Estrogen is high and progesterone is normal, or estrogen is normal and progesterone is low. Still estrogen dominant. Estrogen's too high compared to progesterone. Yes, ma'am.
Is there a way if you add in progesterone, can it cancel out the effects of the estrogen dominance, or do you still have to deal with
Sometimes, but I don't think that's the most effective way to do it because you're still estrogen dominant. You're still going to put yourself at risk for breast cancers and things like that. So it might help the symptom initially. You might feel great, but you still want to know if you're estrogen dominant, right? Yeah. In my opinion, I would want to know. Yeah. Did I repeat that question?
The mechanism that is causing this estrogen dominance is still there.
Yes.
Even if you
Exactly.
put progesterone on top of it. And
Yeah.
that mechanism is what's causing
Right.
the
Yeah.
potential for breast cancer.
Yeah, so you're treating the symptom, but the cause is still there, which is kind of against what but sometimes, there's always a place for symptomatic treatment, especially when it's interfering with a, woman's ability to live, things like that. And so there's always a time where you go that route first, but it always wean down off of things, yeah.
do that while you're kind of working on
Exactly. But normally, and we're going to talk about treatment in a minute. Bioidenticals are great, but sometimes you can use, most of the time I use herbal treatments, nutrient treatments to manipulate hormone levels even before bioidenticals. And if you do use bioidenticals, I always say no more than 3 years. Try to wean down off of them. And then start natural things and, lifestyle changes. If you want to prolong your life, quality of life, reduce your risk of cancers and all that stuff. Sometimes people are on hormones till their 90s. I've seen that before. Okay, so that's menopause. So basically, that's where I wanted to show you that yes, your estrogen is dropping, but it still can usually be considered estrogen dominant during that time. But everyone is so different. It's very individualized. Don't forget that. Okay. All right. So effects of estrogen. How am I on time? Effects of estrogen dominance. This is just a little graph. Strokes, heart disease, loss of muscle tone, increased body fat. So a lot of times people have a hard time losing weight. There is a component of estrogen dominance in there, as well as insulin resistance. There's a whole lot of things that cause that. Decreased sex drive and sexual function. And then also in men, enlarged prostate and prostate cancer is usually, or most of the research I've read and what I was taught in school is not necessarily high testosterone, is usually estrogen dominant condition. And estrogen can be converted to testosterone too. So, okay, what causes estrogen dominance? That's what we want to know. Stress. What does stress not cause, right? And I'll go and talk about how stress causes estrogen dominance. Excessive estrogens made in the ovaries, obviously. Excess estrogen metabolites, like I talked about, the bad estrogens being too high. Environmental estrogens, okay, and we're going to talk about what those are and how to decrease those. I didn't give you a handout on that. Increase those in your lifestyle. And then also synthetic estrogens. So synthetic estrogens are your birth control pills and your hormones, right? Your bioidenticals as well as prescription hormones, okay? So stress. How does stress cause estrogen dominance? Well, so most women, when they're really, really stressed, what happens when they're during their menstrual years sometimes? Right. They lose their cycle altogether. And what did I tell you earlier? If you lose your cycle, you're still estrogen dominant, lack of progesterone. And part of why that happens is that when you're really stressed, most of your progesterone is going to making cortisol for stress, to helping combat stress. High cortisol, progesterone makes cortisol. And so you have that lack of progesterone, you become estrogen dominant, you don't have a cycle normally. And then also, if you're too stressed, your body probably doesn't want you to get pregnant. So it's probably not a healthy thing. That might be a reason why women lose their cycles too. So body's pretty amazing in what it does. So that's basically what this PowerPoint says. You'll lower your progesterone. Okay, that's why women lose their cycles during extreme stress. Also excessive exercise, because that will lead to high cortisol levels a lot. Women that, run like crazy or spend hours and hours in the gym every day because they're worried about their weight will lose their cycles a lot. Okay. Any questions about that? No? Okay. All right. So environmental estrogens, you see them all over the place now. They're in our agriculture. They're in our cattle. Chemical estrogen, so that's these are chemicals that are estrogen based. So the chemical structure looks like estrogen, and they can bind to the estrogen receptors in the body and cause high estrogen issues, okay? So pesticides, plastics have estrogens in them, so think about baby bottles, plastic toys, stuff you chew on all the time. You heat your food in Ziploc containers, things like that. Ziploc bags. American cheese wrapped in plastic. So you kind of want to start really taking all those habits out of your lifestyle as much as you can. Use glass, use those glass containers, put things in glass, try not to eat too much plastic stuff. A lot of our food is plastic.
Yeah, what about the BPA, the biphenyl, whatever they call it?
Right.
Does that make a big difference,
that is,
or is it just sometimes just plastics in general?
BPA is a little bit worse. That's why you say it's a component of plastic. That's why you'll see some, no BPA, that kind of thing. I would try and avoid plastic as much as you can. Yeah, get your load down as much as you can. You can't live in a bubble, but you can, there's a lot you can do, okay?
Bubbles made of plastic anyway.
Yeah, true. There you go. Thank you, Dr. Ron. He said a bubble is made of plastic for those that are listening. What's that?
How easy is it for the plastic to actually rub onto your food though? Like if you're storing it, I've had
pretty. Yeah, honestly, I don't know all the exact research on it, but especially if you're microwaving it or freezing it, like if you freeze freeze your soups or something in those Ziploc containers, that kind of thing, you're more at risk. Freezing water bottles, things like that, you don't necessarily want to do. I don't know the exact research behind how much is excreted into the food and stuff, but I do know it plays a part, okay? Solvents, fire flame retardants, things like, like the stuff that's on infant clothes, fire retardants that they put on baby clothes, stuff like that. That's estrogen-based. Solvents, carpet glue, things like that have estrogen-based component to it. Okay, so that's just a few examples. Okay, synthetic estrogens, I already talked to you, birth control pills, hormone replacement therapy. Those are a way to get estrogen in. So balancing estrogens, we talked a little bit about this already. Organic foods is very important, okay? Getting the pesticides, not ingesting them, or at least really, really washing them. There's something called the dirty dozen. You can go online. I have a handout I give to patients sometimes, but you can go online and find out. Those are the dirtiest foods, and if you're going to buy anything organic, buy those. It's called the dirty dozen. But if you wash your food, I think vinegar and water mixture is one of the best things to wash to get the pesticides off, from my understanding. Dr. Ron, do you know anything better? No? Okay, so you can just get a little spray bottle of vinegar mixed with water and wash them. And then wash the vinegar off. Yes?
How much vinegar do you use?
I do a 1-to-1 ratio. I don't know what the exact ratio is. That's what I use. I should look that up, though. Okay. Reducing your use of plastics. I talked about that. Okay. Pesticides in foods. Oh, I didn't realize I put this slide on here. All right. Those are the highest. Okay. So these are the ones, if you're going to buy organic, buy those. Okay. And these are the least ones. So don't worry about organic bananas as much.
So this is our dirty dozen.
Yeah. And, believe it or not, sometimes the organic costs less or costs the same as the other. So don't... When I lived in Raleigh, North Carolina, you could go to the grocery store, and they had a pretty abundant supply of organic vegetables, and the apples were actually cheaper. They were better. So they were $1.89 a pound. The other ones were $1.99 a pound. So Walmart's a little cheaper, though. You can go to Walmart and get it, but okay. So that's the pesticides in foods. Reducing pesticides, I told you that. Some companies even deliver to your house. I don't know about Wichita. I haven't researched into it yet since I've been here, but I know a lot of organic farms in North Carolina would deliver to homes, and it was very reasonably priced. So grow your own. Make sure you don't buy genetically modified seeds, though, if you grow your own, because sometimes you don't realize that's what you're buying. Okay? And prioritize. So I don't remember what I meant by that, but I think I meant spend your money. I would at least buy those top organic, especially if you have female problems or a history of cancers in your family, okay? All right, plastics. Here, I go into more detail about the different types of plastics here. I'll let you guys read through that. But, the peanut butter containers, that's why Smucker's All Natural puts it in glass. Better one to use. Squeeze bottles, especially things like squeeze butter. You're just asking for estrogen, because all that plastic butter already has a lot of fat and pesticides in it from the cow, and then you put it in plastic, probably not a very good food to eat.
I have a question too. What do you feel like, the information about children too? Because I know they talk about the baby bottles and those kind of things, but even like some of the foods and the waters and all those things, and you see such an early onset of, puberty and menstruation a lot of times and things like that. Do you,
I would have.
This is not just for us grown-ups, it's kind of applicable to the children.
Yeah, definitely. I would at least, I use glass bottles for my kids were nursed, but they still worked. So I tried most of the time to use glass bottles, although not all the time. I don't live in a bubble. So there are safer plastic bottles you can get. I would get those, but plastic toys, a lot of stuff you put on their skin, I wouldn't put on their skin. Use the all natural diaper stuff. Don't coat them in a lot of the lotions and stuff like that. I never did that, but yeah.
But even as children are eating.
Oh, yeah.
I don't think about that. Like I do microwave and store a lot in the plastic, and then, getting it too.
Yeah, and if you use milk, buy organic milk for your kids. Give them organic. Don't give them the other stuff. That's in my opinion, but.
Is organic milk, like, we buy the stuff that's, what is it, RB, whatever.
The hormones are not in there?
Hormone-free. Is organic still a lot better than
I still would buy organic. I would.
Well, the nice thing about organic is usually they're not putting estrogens into their cows, but but
Right.
it's not always true. You have to
Right.
really do research.
And I got to do the research too. Dr. Ron, do you know about organic milk? Do they eat pesticide grains or something? They're not supposed to. Yeah. So they're supposed to eat grass too, I think, and no pesticides on the food that they're eating or anything like that. So, yep. And I think like some like Walmart, for instance, I saw that in the news. They banned hormone milk. Like they don't sell any milk that has hormones in it. I don't know where I read that. New York Times or something. So polycarbonates, baby bottles, those 5-gallon water bottles, things like that. You can get the glass ones delivered to your home. Okay. We talked about this. Cling wrap, avoid. We talked cold and hots. Don't use, don't heat and don't put in the freezer, plastics. All right, how do I know if I have hormone imbalances? So you have a sheet in front of you. You're probably going to laugh when you read through it, but those are all symptoms of, your hormones being off. Yes, ma'am.
Going before you
Sure.
back to the microwaving,
Uh-huh.
other than using plastic, what about just using the microwave?
Using the heating food in general will deplete nutrients. I would say heat on the stove would probably be the best way to do it. But I don't know. Dr. Ron, do you know about, there's conflicting info about microwaves and what it does to the food, but I do know heating the food in general is not good, especially with the microwave because you're getting hot very fast, and probably not the best way to heat your food. So I definitely wouldn't cook in the microwave. Like, people make lasagna and all that stuff in the microwave. Don't do that. I barely use the microwave for anything because I don't pop popcorn in the microwave. You don't make instant oatmeal. I do everything on the stove. It's just reheating foods. But you can just reheat it very quick on the stove in a pot. That's what I do. But yeah, I would try to avoid the microwave as much as you can. Don't heat your water like if you're doing. Use a kettle on the stove, just a better way. Yes?
What about paper? Does this have, got some
Yeah, you're right about that. I don't know what's on the coating of the paper. I don't know.
Would that be better than plastic?
But I'd rather paper. But the coating inside, like these, yeah, that's a good question. It's usually just wax, but I don't know. Do you know what's in? I got to research that. Good question.
You can drive yourself crazy if you
I
go
know.
too far with
Yeah.
it. I think it's a process of evolution.
Yeah,
and you
exactly.
Start to become more aware of this and start reading
Yeah.
on it and start to move in the
Yeah. I mean, most
direction.
of the time you're not drinking out or eating off of this very often enough. Use plates at home, that kind of thing. But if, once a week, twice a week you eat off paper, probably not a big deal.
I mean, like heating the microwave. We
Yeah.
don't heat in plastic. 'Cause
Yeah.
We have very many glass things. I've got kids and
Yeah. I mean,
drop it.
yeah. I don't know what to tell you.
Maybe better
Yeah.
than plastic.
Probably better than plastic. Yeah. Or just put it on a plate. But if the kids use paper plates all the time, teach them how to not drop the plate. I've only gone through 2 drop coffee mugs in the last couple months. Okay. All right, so all kind of symptoms. Most people have some form of hormone imbalance for the most part. You can measure your hormones, there's salivary, blood, and urine. I use all 3 to measure hormones.
I have a question.
Yes?
No. Well, there's a lot of debate about where the best way to test the hormones. Some people say the blood doesn't tell you anything, but other people say that it's only in the saliva. So what is it?
It depends on what hormones you're looking at. I like to do, for female hormones, the blood at the right time of the month, if it's a cycling woman, as well as you can look at urinary metabolites, 24-hour urine. Sometimes that especially gives us an idea of whether, this is really going into detail, but whether or not estrogens are being methylized or methylated the right way, things like that, how the liver is functioning. But normally I start with the blood and to see the 2:16 difference, but the urinary can be done as well. And sometimes I use that one too for women.
It's true that the active hormones don't ride in the blood. That's just something I've heard, that active hormones only ride in the saliva, so that's really the best way to test it.
Well, you want to get the metabolites. That's what's important, and that's where the urinary and the salivary can come in, unless you use certain labs that look at metabolites in the blood. If you just go to the doctor and get estrogen and progesterone, not the best test. And that's what I see a lot of people do, and I'm like, well, what day did you have it done? They didn't tell me, and that doesn't tell you nothing because you saw how they fluctuate, right? And you want to see mostly around day 20. So it depends on the woman, day 18 to day 22, if they're cycling. when to measure blood levels of
So
hormones.
if your doctor wants to test your hormones, what should you ask them? Be looking to do that day on the day 20, is that what you're saying?
Yeah, usually day 20 to 22, or 18 to 22 is the right. But you also want to get the metabolites. And most doctors don't do that yet. So, yeah, unfortunately. Some OBGYNs do. Yes?
So you're saying test at a certain time, but what if you're in menopause?
In menopause, it doesn't matter.
Okay.
In menopause, it does not matter.
What about if you're on birth control?
If you're on birth control, it's not going to be very effective to do that. Okay, probably rather do urinary metabolites if you're on birth control. Birth control, you're wasting your time, kind of, because birth control shuts off your own production of hormones. So, and that's how you regulate your cycle and prevent ovulation, because you're keeping your hormones not regulating like I showed you, right? You're not having that ovulation peak, so you're not ovulating. So you're kind of manipulating hormones manually, and so it's not gonna. And when you're taking hormones, it shuts off your own production. So, and that's why it helps with endometriosis sometimes, or usually they put you on birth control pills because it's shutting off your own production, and you're monitoring your estrogen levels. But not all the time does it help in those disorders. So, good question. Did you just ask that? Yes. Okay. Any other questions thus far? Sorry, guys, I'm kind of all over. Okay, so treating estrogen dominant conditions. So now I'm going to go through kind of, again, it's very individualized with people, but I'm going to give you some ideas of how I treat these disorders. Diet and food, sometimes supplementation, especially nutrients and herbs. And usually within 3 to 6 months, you can have your hormones regulated without hormones enough if you're compliant and you do all the necessary things. And then lifestyle modifications as well. So let's just go, and again, I'm touching on some of them. I don't have time to sit here and tell you everything, and I don't want to confuse you too much, but I'm going to sit and talk about some of the biggest different herbs and nutrients that I use, okay? So dietary changes, I went ahead, instead of sitting here, because I could talk for hours on that, I printed out something for you guys. So you guys have at least a take-home that you can start doing dietary-wise. If you're having issues, share it, make copies, scan it, send it to all your friends. Post it on Facebook. So see the handout, okay? And a lot of it talks about what we already talked about a little bit, okay? If you have any questions after, please ask me. Okay, all right, so nutrients and supplementation. Okay, I just went ahead and I don't have too much time to talk about everything, but these are the nutrients that are really utilized in dropping estrogen dominance and helping regulate hormones, okay? B6, B12, folic acid. Now, what we call these are in this TMG, trimethylglycine. These are methylators, so if you're having a problem with methylating estrogens in the liver, which I talked about briefly, that will help, and that will help hormonal problems, dropping the estrogen levels down. Vitamin C, vitamin E. So I told nutrients that help with methylation. So things like MSM, you might have heard of, that can also help a little bit. And what?
What is the TMG? I've never actually heard of that. Is that something you can?
You can get it in a supplement form. Yeah, and sometimes it's in a supplement form. It's combined with folic acid, B12, and B6. Yeah, I think we have, I don't use it all that often, to be honest with you, but it is something you can use. We do have it upstairs that you can use. And basically what it does is adds methyls to the estrogens, and that makes estrogen protective. Okay, a lot of people have a problem with methylating. And that's a talk for another day. But because if the estrogens aren't methylated, it's converted more to the bad estrogens, okay? All right, so nutrients for estrogen dominance. These are some other ones that I use often. You remember how I talked about broccoli and cauliflower and Brussels sprouts and those wonderful cruciferous vegetables that most people, for some reason, don't like? But again, that's what I use. This is actually the components. If you buy it in supplement form, that is what might be on the label, okay? And it produces the C2, the good estrogen. And calcium D-glucarate is not calcium, okay? It's not your calcium citrate and stuff. It's something totally different, okay? And that actually helps with estrogen metabolism in the liver. N-acetylcysteine, NAC, It's a precursor to something called glutathione, which is an antioxidant, and that helps with liver detox of estrogens in the body. Okay, so that's something that's also good for people with sinus congestion and a lot of other problems. And a lot of times when I see women with hormone problems, they have a lot of all that too. Okay, and that's where taking a holistic approach is very important, because you know what to do. And because I have 2 endometriosis patients come in, and sometimes their treatments, they might be a little bit the same, but totally different. Okay. Probiotics help with, you probably heard of probiotics. Those are the bacteria for your GI tract. Those are very good for a lot of things, but they help with estrogen elimination in the GI tract. So if you have been on a lot of antibiotics or you're constipated, most of the time people will end up in the over course of a few years have female problems. And you want to make sure you get those bacteria back in there so that it can help with getting the estrogens out of your GI tract. Otherwise, they will be reabsorbed and cause estrogen dominance.
Do you recommend doing that every day or only as needed?
Most people, especially in the beginning, every day. I mean, if you do that every day for the rest of your life, probably okay, fine, especially at the right dose. But it's at least for 3 to 6 months in the beginning, doing them every day. And then I have people do them when they start getting sick or other things, because it helps with immune health and stuff too. Yes?
Is that probiotics?
Probiotics. Yes, that's probiotics that I was talking about. Okay. Oh, cutie. Okay, botanicals, that's herbs, herbal medicine, botanical medicine, same thing. These are the top that I'm just going to talk about. I don't have too much time to talk about them, that I use to help with female issues. And you probably have heard of some of these before, okay? Vitex, Semisophusia, which is black cohosh, rhodiola, licorice, and taraxacum, which is dandelion root, not the flowers. Yes?
When you use these, is this because after blood work, urine work, and all that, that's why you decide, I may not eat all those, but 1 or 2? Is that
Yep.
correct?
Yeah, that's correct. So what the lab work, I mean, I could still treat people blindly based on taking a holistic intake. I never recommend doing that because, you know, sometimes high progesterone can be the same symptoms as low progesterone. You just don't know. And it's best to do that. But measuring your levels is not just for bioidenticals or getting on hormones, knowing what dose to give. It tells me what herbals to use, what nutrients to use, and can explain a whole lot of other things. So I like to look at it because I know, based on what it comes back as, what ones to use. And I didn't talk about testosterone, but treatment of testosterone in these. But for instance, if a woman's testosterone is too high, there are other herbs that I would use to help lower testosterone. And it's a lot of the same herbs you use for men in prostate problems. Okay, and we'll actually talk about a little bit of that in just a second. All right, so Vitex, one of my favorite herbs ever. I love it. It works very, very good, very well. Works very well. It basically, what it does is it acts on the pituitary gland. Remember that gland, the master gland I talked about? And it increases that LH hormone that causes ovulation. So through a roundabout way, Vitex increases progesterone levels. And it can help with menopause, everything basically. Okay, amenorrhea, especially women who are not having cycles, I usually can get them cycling within 3 months taking this. Although, let me show, hold on. There's no immediate effect. So I've had people come in, oh, I tried Vitex and it didn't help my cramping. Well, they were taking it like it was a medication. You gotta take it almost like it's a birth control pill. Every morning. If you forget all your other supplements, that's fine. Just don't forget Vitex, because you're manipulating hormones. You're not blocking a pathway. You're not causing an immediate effect. You're changing the pathway, and it takes a little time to do that. So normally within 2 months, I always tell people, wait, take it for 3 months. And I had one person, it was like almost 3 months before I haven't started my period. I'm like, just finish the 3 months. She called me up, oh, I started my period today. So not many people are excited about that, but she was. She was very excited because she was having problems. So it's used for luteal phase defects, so people that have that short cycle, that 21-day cycle, it will help increase the chance of ovulation. So it will affect the LH hormone. So I know you mentioned that earlier about short cycles. This is one of the best things to help with short cycles is taking Vitex, but you take it daily, usually in the morning. But I dose it differently depending on the person, okay?
Once the cycle returns, is this thing what I'm doing?
I usually tell people to continue it for maybe 1 or 2 months. It depends on the person, and then get off of it. And normally they don't have a problem if they're doing everything else. You know, it's not just a one, like it's a combination of a lot of things. But because you don't want to go back to that, you got to remove the cause. Okay, but the effects aren't immediate, but they're long lasting. Okay. That's my point there with Vitex. Okay, drug interactions. I went ahead and I'm not going to have time to talk about all of those, but I went ahead and put some on there. Vitex also increases dopamine levels. Dopamine is one of the feel-good hormones. It drops prolactin levels too, so if you ever had high prolactin, it can help with that. You might not know what that is, but you would if you had high prolactin. Yes?
Does Vitex have an effect on testosterone levels?
No, I don't, I have to go and look from the research that I've seen, no, it doesn't. It increases LH, which will increase progesterone and actually prevent the estrogen dominance. I don't think it'll increase testosterone levels. I've never heard that before. No. Why? Have you had a problem with that or come in?
I have Vitex scrubs, and originally when I first researched it, the Roman troops took a Vitex to
Increase testosterone levels?
being horny all the time.
Well,
And then they've just been,
it could be dropping the estrogen dominance effect, which will help with that as well. Which so I mean, I'm not sure about it increasing testosterone. I mean, if it does, it might a little bit, but that's not really what it's been used for. But Vitex is a great herb. You just don't want to use it in people with Parkinson's disease or if they're on dopamine agonist or drugs that raise dopamine. So it'll make the drug work more. So you don't want to use it with these medications. But that's about it. All of these, though, you're always at risk for an allergic reaction. Just remember that. I mean, anything you take could possibly be an allergic reaction because that could be a side effect. Semisufugia, black clohash, people take it for hot flashes, right? You probably heard that all the time. We have something called Minicaps up there that helps. It has some black clohash in it. It has Vitex in it as well. But it will not raise your estrogen levels. It's not a phytoestrogen at all, but it does bind to estrogen receptors, okay? So it's great for hot flashes, PMS, sweating, but it's used, you really want to know your hormone levels, what's going on before you start using a lot of these things. But if you're having just hot flashes, you can try some black cohosh a few times a day, and that can help. But yes.
because it seems like these would almost counteract
Yeah,
each other, like
exactly.
one is decreasing and one is increasing.
Yeah, exactly.
You would use them together?
That's not necessarily all the time. And Vitex does a lot of other things than increase LH levels. But that's why knowing your hormones is important to figure out which ones to use first. Don't do it in pregnancy and breastfeeding. These are some of the drugs that it interacts with. It may enhance the effects of tamoxifen if you're on tamoxifen. Some women actually choose to get on black cohosh instead of tamoxifen if they've had breast cancer. Tamoxifen drops estrogen levels. It's a medication most people get on after breast cancer.
And
Okay.
there's the iron situation.
Mm-hmm.
Is that why you're just kind of assuming that they must be menopausal and not need iron? Because a lot of us women need iron, so.
Do not take it no, that just means if you take it the same time as your iron supplement, that it'll bind together and your iron won't be absorbed.
Okay.
Yeah, it'll bind the iron.
Okay, gotcha.
Yeah, don't take it at the same time and, don't swallow it at the same time. Dandelion, it helps with detoxification. It's also good for, it pushes the pathway in the liver that detoxes estrogens. So that's why dandelion is good. It also has a lot of vitamins and nutrients in it, which is a good thing. Yes, ma'am?
What about dandelion tea, the herb tea?
You can do that. Dandelion tea is something great that you can add to your lifestyle. That'd be great. Yep. She asked about dandelion tea. So dandelion has a lot of good effects. These are other things dandelion helps with. Anti-inflammatory, it's an antioxidant, it's a diuretic, so it helps if you have a lot of swelling or high blood pressure. It can help lower blood sugar. It only interacts with some anticoagulants, so things like Plavix, Coumadin, okay? If you're ever on Plavix or Coumadin, always consult a physician or, well, not a physician, probably someone like me who knows about the herbs, what herbs to take and what not to take. Most doctors don't know. Licorice. Licorice is a great herb. It supports the adrenal glands, is what I use it a lot for. Basically, it stops the breakdown of cortisol in the cell. So if you have a lot of adrenal fatigue, it'll help raise cortisol. But it's not going to raise cortisol to where you think you're going to gain weight or anything. Okay, it's not like that. It can help raise progesterone levels as well, okay, because you're helping raise cortisol. And this is great to take during stress. If you have stress and you have menstrual problems, this is just a great herb to take. It can help raise blood pressure. And a lot of people who are going through stress and have adrenal fatigue have low blood pressure, and they actually want to raise it, but it's not going to raise it to be hypertensive. You know, you might hear that a lot. I've never in my life seen that happen. Even people that have high blood pressure, sometimes I'll use it. I'll have them use it a little bit. I've not seen it raise it like that. If anything, you're raising it for a good thing for the people that have fatigue and adrenal problems. It also inhibits an enzyme, I'm running out of time here, called 5-alpha reductase. There's a lot of meds that do that as well, but that is what stops the conversion of testosterone to DHT, and that is what causes male pattern baldness or female hair loss and acne. So it helps with that as well. So I use it in men as well with saw palmetto sometimes. You use that for high DHT levels, dihydrotestosterone. Okay? So you have a lot of women that have a lot of acne later in life and hair loss. A lot of times it's DHT levels that are high. But you don't necessarily have to use these. Sometimes just dietary changes and nutritional stuff does it. Okay. Other uses, licorice is great. Antiviral, bacterial, anti-inflammatory. It helps with preventing blood clots. Antioxidant is also good for ulcers and healing the GI tract. A lot of times you'll see DGL. That's deglycerirized licorice, used for GI stuff or reflux, things like that. DGL will not help with adrenal fatigue and will not help with other hormones. So if you're using it for that, you want to use pure licorice or licorice, not DGL. Okay, because the deglycerized is deglycerized. The glycerin part of the licorice is what helps the adrenals and all that stuff. So, because I see people come in, oh, I tried licorice, it didn't help, I didn't have a problem, and they brought it in and it was the DGL form, and that's not the right form. Okay, lifestyle modifications. Okay, exercise, of course. Strength training, aerobic exercises is great. I mean, sometimes I tell people come in and they're doing too much exercise, their cortisol is too high. I tell them to stop what they're doing, do more long walking, things like that. So sometimes I do prescribe less exercise for people during the time that we're trying to support the adrenals and do some changes.
How does yoga fit into that?
Yoga's great. Yoga would be fantastic. Breathing, I talk about breathing. So many people hold your breath. You're probably holding your breath right now listening to me because we tend to hold our breaths when we're concentrating on things. When you're in class, you're taking a test, you're driving, it's raining, you're holding your breath. Breathe, okay? Because your metabolism needs oxygen. It will not work. You will increase your metabolism once you start doing deep breaths. You will increase your metabolism. Most people do not breathe. They breathe shallow. So breathe. It's very cheap to do too. Doesn't cost a thing. All right, stress reduction helps all hormones. Have fun. That will help your hormones. Most people, I sit there, usually I always ask people, what do you like to do? You know, where are you from? What do you like to do? And I say, what are your hobbies? They look at me like, changing diapers. You know, I don't have hobbies. It's important to go out and have fun. That will help raise your dopamine levels. I told you Vitex raises dopamine levels. So don't forget about that, okay? Don't work too hard. All right, sleep, extremely important, okay? You all hear about sleep. That's another lecture for another day, how sleep helps all your hormones. But if you're not sleeping, you're going to have crazy hormone levels, okay? So if you're not sleeping, come see me. I'll help you go to sleep. But the best time to go to sleep is 9 to 10 o'clock at night, 5 to 7 in the morning waking. That's ideal for ideal hormone health. If you tell me you're a night owl and you like to sleep till 10, then I'm going to say you're going to have health problems in the future. You're not a night owl. It's just that your hormones are off because we're all built to follow the sun and the moon and blah, 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 all that stuff. So, yeah, so you can manipulate that. And I have people who come back like, you're right, I'm getting up at 6 o'clock now, you know, so they feel great. So staying up all night, bright lights, all that stuff, not good for your hormones. Okay, so just an overview of what we talked about. I know I threw a lot of information at you guys, but hormones run your body. They all work together, okay? So you can't just zone in on your thyroid, your underactive thyroid, but you really want to look at your adrenals too if you have thyroid problems, and look at your female hormones. Nutrition can affect your hormone levels, so knowing your nutritional levels is a good thing, and it's lucky that here in Wichita we have a lab that can actually measure them, because we're actually one of, 2 in the country that do. Most women with female issues are estrogen dominant. Not always the case, but most of the time it is the case. And it's best to first measure them, female hormones, adrenal hormones, thyroid hormones, but you can still start treating if you can't, because a lot of times costs can come in the way, and I can still help you feel better without actually doing all that if you can't. And work with a doctor that knows how to take a holistic approach to everything, okay? Whether it's me, Dr. Ron, or anyone else around, do that. Go to the website I told you. If you have family members or friends that need help, they'll find someone around in the area that can help. And you want, let's see, what else do I want to say? Okay. This is a good book. We sell this here. This is Dr. Tori Hudson. She's a colleague of mine. She's great. She has this book, if you want, it has basically everything I talked about is in that book. Go look at it if you want help, especially if you're self-prescribing. Don't do that. Either come see someone or at least use that book to help you. And that's one I recommend. And I've read it through about 10 times, and I use it as a resource, okay? And thank you, guys. What questions do you have?
So I have an enlarged fatty liver.
Mm-hmm.
Do you have any recommendations as far as like hormone or like
For fatty liver?
the dandelion and that kind of thing? Is there anything that's particularly good for that?
Really, you want to look at what herbs for fatty liver. That's kind of, dietary stuff. God, that's hard to say, because I don't think there's any one herb for fatty liver. You really want to know why you have fatty liver, what's going on, what else is going on.
It's hereditary.
Hereditary. Usually looking at your adrenal glands, adrenal support, things like that. Like, did I not talk about rhodiola? Was that not in there? Oh, that slide must have been missing. Rhodiola is a great herb to help with adrenal support. It's rhodiola, rhodiola. We have a great one called Adaptanol upstairs that has rhodiola, licorice, a lot of the other herbs I didn't talk about that can help. But we also have rhodiola. That can help with stress reduction, cortisol production. I would say if you're going to start anywhere, start with that. I don't really know what else to say about fatty liver necessarily, unless I know what else is going on health-wise, from an herbal standpoint. But making sure you're getting good nutrition, your nutrient levels are where they need to be. It's going to help with fatty liver. Okay, so yes, what a good question.
When you're prescribing herbs, or what's your recommendation? Like, I know there's tinctures and there's capsules, and which is best absorbed? Or does it depend on
Well, I use a combination of both. I try to, if someone absolutely will not take a tincture, I'll put them on a capsule. Most of the time, I find that most people do not want to do tinctures, so they do capsules. Sometimes tinctures, I think tinctures usually are the best most of the time, best absorbed. But you got to make sure you're, like Wise Women Herbals, Gaia is a good company to get from. But you got to be careful, especially if you're using capsule herbs. Don't go to Walgreens and get an herb, okay? Because those companies are not regulated. They're not, the stuff like that we use, that the ND profession uses, the naturopathic doctors use. They've all been tested not only by the companies but by our community of doctors. We know what's in it. A lot of the stuff that you buy, the herbs have been sitting there for so long. All the active components they're gone. Okay, because there are a shelf life for those things, and those things sit on the shelf for years. So be cautious of that. Did I answer your question? The tinctures are good. Pure extracts can be good. I have like licorice pure extract, hawthorn pure extract I use a lot. But I play with the people's lifestyles and what they want to do.